Having a first aid kit and a trauma kit is just one aspect of emergency preparedness. It's also important to educate yourself and your family about basic first aid techniques, to stay informed about local emergency resources, and to consider taking first aid and CPR training courses to enhance your knowledge and skills. A first aid kit and a trauma kit serve different purposes, and even though they may contain many of the same items, they are designed to address varying levels of injury severity. Here's a breakdown of the key differences between the two and why they are both very important. A first aid kit is typically meant to provide initial care for minor injuries, illnesses, and everyday emergencies. It aims to address common injuries such as cuts, scrapes, burns, sprains, and minor allergic reactions. Now, we'll cover this in more detail in just a moment, but a basic first aid kit usually includes items like adhesive bandages, antiseptic wipes, gauze pads, adhesive tape, tweezers, scissors, and pain relievers. It focuses on immediate comfort, preventing infection, and promoting healing in less severe situations. A trauma kit, on the other hand, is designed to handle more severe injuries and potentially life-threatening situations. It is geared towards providing immediate care for severe bleeding, traumatic injuries, and critical emergencies until professional medical help arrives. A trauma kit contains specialized supplies to control severe bleeding, to manage airway and other breathing issues, and to stabilize injuries. Items like tourniquets, hemostatic agents, trauma dressings, chest seals, airway management tools, and splinting materials are commonly found in trauma kits. These kits are typically used by individuals with more advanced first aid training or in environments where there's a higher risk of severe injuries, such as outdoor activities or remote locations, or in disaster situations when professional medical help might be delayed or otherwise not readily available. While certification can provide formal recognition of your knowledge and skills as it comes to first aid and trauma, it is not a mandatory requirement in all situations. Many individuals learn basic trauma care skills through first aid and CPR courses, through community training programs, or some of the great online resources that are available. As both the first aid and trauma kits serve important roles in different scenarios, we actually recommend building a hybrid or combination first aid/trauma kit to have as an integral part of your emergency preparedness. We'll begin by listing the basic first aid items recommended by the American Red Cross, and then we'll cover the important trauma care items that you want to add to your kit. We begin with absorbent compress dressings that are 5 by 9 inches. Now, these are used for covering larger wounds or as dressings for more serious injuries to control bleeding and prevent infection. Assorted sizes of adhesive bandages. Now, these are commonly known as Band-Aids and are used to cover and protect small cuts, scrapes, or blisters. Adhesive cloth tape, 1 inch wide by 10 yards. This is used to secure dressings or gauze pads in place. Antibiotic ointment packets, usually approximately 1 gram in size. Antiseptic wipe packets used to clean wounds and prevent infection. These can be applied before applying bandages or dressing. Packets of aspirin. These can be included for individuals who are not allergic and can benefit from pain relief or as a potential heart attack response measure. An emergency or survival blanket for keeping people warm when shock is a possibility. It provides insulation and protection from hypothermia. A breathing barrier with a one-way valve. This is vital for performing CPR while maintaining a barrier between the rescuer and the victim. An instant cold compress. Now, these can provide relief and help reduce swelling in case of sprains, strains, or minor burns. Non-latex or nitrile gloves. Wearing gloves helps prevent the spread of infection and ensure personal safety when providing first aid. Hydrocortisone ointment packets, approximately 1 gram each. A 3-inch gauze roll or roller bandage. A 4-inch wide roller bandage. Now, these are useful for providing support and compression to sprains, strains, or joint injuries. 3-inch by 3-inch sterile gauze pads, 4-inch by 4-inch sterile gauze pads, an oral thermometer which is non-mercury and non-glass, triangular bandages. Now these versatile bandages can be used as slings to immobilize injured arms, as well as creating splints or tying dressings in place. Tweezers. Now these are used to remove splinters, foreign objects, or ticks from the skin. And finally, an emergency first aid instruction booklet. Now those are the items for a basic first aid kit. Now we'll add on the trauma kit items. We'll point out the items we've already included, as well as a brief description of what these trauma items are for. Now here are some of the essential trauma items you should consider including. Gloves, which we've already talked about. You need to protect yourself and others from contamination when providing care. In fact, we recommend multiple pairs of gloves in very easily accessible locations. A headlamp. Well, because all accidents don't happen in the daytime. A survival blanket, which we've already covered, again for keeping people warm when shock is a possibility. A tourniquet, which is an effective tool for controlling severe bleeding from an extremity. Look for commercially available tourniquets designed for one-handed application. Hemostatic agents. These specially designed dressings or powders promote blood clotting and are useful for controlling excessive bleeding. Trauma dressings and emergency bandages. Now, these large absorbent dressings are designed to cover and control bleeding from deep wounds or lacerations. They are ideal for applying pressure and providing compression to control the bleeding. Chest seals. Airtight and occlusive chest seals are used to treat open chest wounds and prevent the entry of air into the chest cavity, which can lead to a collapsed lung. Airway management tools. Now, these may include oral airways, nasopharyngeal airways, and a pocket mask with a one-way valve, which help maintain open airways and assist with artificial respiration if necessary. Shears or scissors. Strong medical-grade scissors for quickly cutting clothing, tape, or bandages to gain access to the injured area. The CPR mask, which is a pocket-sized barrier device that allows you to safely administer rescue breaths during CPR. Quick clotting gauze. Now these specialized gauze pads or rolls are impregnated with clotting agent, which aids in controlling severe bleeding. Adhesive tape. Medical tape for securing dressings or immobilizing injured areas. Again, triangular bandages. These are versatile bandages that can be used as slings, tourniquets, or improvised dressings. Splinting materials. Sturdy materials like SAM splints or rolled up newspapers can be used to stabilize fractures or immobilize injured joints. A Sharpie and a notepad, useful for documenting vital information about the patient, such as the time and details of an injury, allergies, or any administered treatments. Remember, the items mentioned above are general recommendations, and the contents of the first aid/trauma kit can vary depending on your level of training, intended use, and specific needs. Consider the size of your family and different emergency scenarios to ensure you have enough supplies. For example, if more than one person is injured, or if emergency responders are not available and you need to change a dressing, do you have enough supplies? Think about the specific healthcare needs of your family when putting together a first aid kit. For example, if you have a family member with severe allergies, include antihistamine medicine and an epinephrine injector. If you have elderly family members with fragile skin, include a roll of paper tape that can be useful for protecting delicate skin. If you or a family member lives with diabetes, include a juice box, glucose tablets and gels, and an emergency glucagon injection kit. Include chewable baby aspirin, which might be helpful to someone who has coronary artery disease, provided the person is not allergic to aspirin. It is valuable to receive proper training in trauma care and familiarize yourself with the correct use of all the equipment in your kit. Again, remember there are excellent online resources that provide basic trauma care instruction for free. Family, friends, coworkers, and bystanders, and not the first responders, are normally the first on the scene in a medical emergency. First aid and trauma kits have changed over the years, but they are as useful as ever. They make it possible for ordinary people to be the help until professional help arrives. This concludes another Build a Kit video in our Emergency Preparedness series. Check out our website to learn more about getting informed, making a plan, building a kit, and staying informed as it relates to your family's emergency preparedness.